Uh, Me, Tim, Rupesh, Dr. Mignon, we've been working on a dream project since last few years. So can I ask all of them, Tim, Rupesh, Mignon, to share about our dream project with all of you? Dr. Mignon, Tim, can we have the slide, please? Yeah.
Passion makes friendships. I kid you not. This book, which is coming out this year, is a passion of Sidharth's, Rupesh, Mignon, and myself. But it's actually because of friendships. We've gotten to know each other for decades. And I would hope that each of you who are in your early grade stages, in your middle stages, later stages of your training, understand that your colleagues throughout the world are your best and most helpful resources. This is a bedside book that it was Sidharth's idea, Rupesh's idea, that came out of a meeting we did in Brazil, and then we did in Orlando. This hopefully will be a book that will allow you to go to bedside and say, I don't need 17 pages of verbiage. I want 7 ideas on how I can help this patient immediately. That's what this book will do. Passion makes friendships. Congratulations, Sidharth, Rupesh, and Mignon on their efforts.
And that comes from a man who isn't a day over 30, because I'm not a day over 29. So thank you for that, Tim. I think it's really exciting that this book is being launched. It's been really hard work, and I think Sidharth in particular has been driving it. You've really got to have a strong and positive nagging ability to get people to get chapters in on time, and you've done that really well. I think it's really exciting because it's a practical book, so it's not theory. You can look at that online, you can look at articles online, but we're hoping that this shares our little tricks of the trade, and it's only the first edition. We hope there'll be more after this, but it's something that people in all parts of the world can actually take home with them and actually use from a clinical point of view, and to use it to save the lives of children. So I really think it is truly a multinational book, and we really hope you enjoy reading it. Thank you.
Good morning, everybody. Now, I will be very fair, this was not easy. When we were doing the book, it took a lot of work. It entails a lot of phone calls to an extent. Nobody was returning my calls in US because they know I was chasing for the chapters. But definitely the book is very practical. It has a lot of insights how to practically manage the patients at the bedside, which is kind of lacking in the pediatric world, because in nephrology, in the adult, we have a lot of books that we have an approach for the practical purpose. So this was a lot of hard work, definitely, and putting together, it took us almost like 1 year to get the book out, and definitely I want to thank Sidharth for his vision, because that was his idea of putting forth the book for the handbook, and definitely Tim, a mentor, and Mignon for supports. But I hope you like the book and appreciate our all hard work, and we wish all the good luck to the pediatric nephrology community here. Thanks.
Thank you, all of you. In fact, attending the PCRRT meeting over the last many years, we've been thinking about that there should be some handbook, at least how to prescribe CRRT, how to prescribe SLED in a child. And whenever we used to think about prescribing, say, CRRT nutrition, we would be just Googling it, looking at some website which can give us some information. So we just thought that we'll have some practical chapters in this. We've tried to involve the best in the business in all these chapters. So can we have, we just have few preview copies. The book will be released online in the next few months. So can we have the first preview copies, and ask all the dignitaries to release the first copies. Can I also invite Dr. Amarjeet Mehta? He is the president of our Indian Society of Pediatric Nephrology. Dr. Mehta, could you please also? Thank you.